Hello, everyone. Welcome to Do Your Parents Want to Stay? My name is Stella Nsong. This is Pen Dynamic Care at Home. This is our weekly virtual educational sessions and series that we do to help the community understand things regarding aging, family caregiving, and all things geriatric wellness. This is where we meet experts who come and they help answer questions for us. This is where the community can come for anything that they need, for guidance on where to find care, guidance on which hospitals to use, guidance on which physicians can help you, and which medical practitioners you need to incorporate into your health and well-being plan. Here we will also talk about family caregiving. We will bring all the experts, the care managers, the physical therapists, the occupational therapists, and all the people you will need. Most people need about 18 professionals. Yes, 18 professionals in their care journey. That can include the physician, the physical therapist, the home health, the hospice, the assisted living, independent living, medical supply, equipment, access into the home, lifts, transportation, all, everything you may need, all 18 services that you need. Here you can get information. So we meet weekly and we talk about pressing things. Every month we have an area of concentration, and this month we'll be talking about after hospital, after rehab care. Next month we're talking about, yes, now that does not mean if you send us your questions, your questions we won't answer. Of course we'll answer. But every month we dedicate it to a special area of concentration. So this month is about after hospital and after rehab care. Next month, we're going to be talking about reducing family caregiver stress. Yes. Then how you manage chronic symptoms. And we go every month, we have an area of concentration. Last week, we had a very, very amazing presenter, and she helped us understand about medical supplies. And she's at Mobility Plus, and we are going to invite her back. Yes, because she was very helpful. She was very educational. We enjoyed talking with her, and she gave us lots of good information. Today, we're going to talk about two big things. So our session is going to be in two pieces. So this is the A conversation today. We're going to have a B conversation later. In our A conversation, we're going to talk about the difference between home care and home health care. Because even in the medical space, there is confusion about what is home care and what is home health. Who does what? Who pays for what? There's that conversation. Then we're going to have a B conversation on how to reduce the cost, yes, of geriatric caregiving. That could be in assisted living, independent living, home care, wherever you are getting care. We're going to talk about how to reduce cost and increase quality of health. All right. So what's home care? So home care in the medical space is defined as the services that provide supportive living, or if you were to use the big expressions, is considered custodial care. In home care, you are providing services that are non-medical. Supportive living. What does that include? Cleaning the house, doing the laundry, going to the grocery store, yes, making the food, doing the linen, socialization, making sure the plants are watered, making sure the pets are taken care of. That is home care. Home health, on the contrary, is skilled services brought into the home by nurses, yes, physical therapist, occupational therapist, speech therapist. Generally, in home care, people pay for it privately, or they may use their managed care insurance. They may use VA benefits, yes, or long-term care insurance. In home health, which is skilled care, most of the time is paid for by Medicare, Medicaid, or health insurance. So why should you care? It's because very often many older adults need both. But when the family members do not know the difference, they go home ill prepared. So here is an example of how someone coming from the hospital or rehabilitation may need both home care and home health. In almost every situation, a family needs both. In almost every situation, Medicare does not pay for both. Okay, so here's what I mean. If someone is coming home from the hospital or from the rehabilitation center, very often they may be weakened. They may be what we nurses will call decondition, or physical therapists, physical medicine, they would say decondition. This is when you have lost the strength and the coordination, the ability to stand and walk. Your gait may be off a little bit. When you're coming from the hospital or from the rehabilitation center, you have gait disturbance, you have weakened muscles, you may not be able to care for yourself as usual, you may not be able to walk as confidently as you used to do, you may not be able to stay home alone while you are recovering. All right, now, for you to stay well, you need somebody to cook and clean and go to the grocery store, pick up the medications, and drop at the dry cleaners. You need somebody to do that for you, bring your medications for you, sweep the house, do the laundry. That is home care. But now here's what I mean by you need both. You also need a little bit of therapy to regain your muscle tone and to regain your strength and coordination. That is where home health care comes in. So in today's world, Medicare or Medicaid or the insurance company will send you a therapist or a skilled nurse, is what they will call it, which is a registered nurse most of the times. And they will come in and they will visit you in your home to see your home environment, to assess and evaluate how safe you are, and to teach you the exercises that you're going to need to get better. Now, notice what I said. Assess, evaluate, teach you. I didn't say do it for you. Long time ago, the physical therapist would come and they would stay with you 5 days a week and, an hour. And they will exercise with you and you'll get better. In today's world, the physical therapist's job has changed. The occupational therapist's job has changed. So they evaluate, they create you a plan. It's called a home program. They teach you how to do the exercise and they expect you, the patient, to do it. Because that's what Medicare wants now in today's world. That's what Medicare wants. So they no longer come to your house 3 days a week for 6 weeks. They no longer do that. The skilled group will come, the nurse, the physical therapist, and occupational therapist, sometimes a home health aide. They will come for a few visits for a few weeks. So here's how I explain it to family members. There are 168 hours in a week. A physical therapist may come twice in your first week you're home from the hospital. And the visit may be 40 minutes. All right, Jennifer, you're doing the math, right? So 40 minutes times 2, that's 80 minutes, okay? All right. The occupational therapist may come twice. All right, so another 80 minutes, right, Jennifer?
Mm-hmm.
The skilled nurse may come once. And maybe he or she stays 40 minutes. Okay, 45. All right, Jennifer, you're doing the math. Add that up in minutes. Okay. Now, you may get a home health aide. This is when you're doing skilled care. You may get a home health aide from Medicare, and the home health aide is there strictly for personal care assistance to do a bath. The home health aide is not sitting there to do restorative therapy or to do exercises. That's not why they're there. They are there for personal care assistance to help do the bed bath, to help put you in the shower. And the aide will spend about 40 minutes, no more than an hour, once or twice a week. All right, Jennifer, let's do it. Let's put 2 hours. All right. Now, if we put all of that together, how many hours do we have? Doing really good. Maybe we have 3.5, 4 hours? What would you say? Yes?
125.
Okay, very good. So let's go 3 to 4 hours in a week. Now we said there are 68 hours. So if you subtract that, who is caring for that patient for that other 164 hours in a week? Who is caring for that person? It's a family caregiver or it's no one. That is where home care comes in. So home care will bring in all the supportive living services, the cleaning, the cooking. But you need both of that to get better. Now, if the Medicare people are only going to give you this small amount, you cannot get better that quick. Why? Because for every day you have spent in the hospital, you need 3 to 7 days to get better. So between the hospital and the rehabilitation center, if you were gone for a month, for 30 days, yes, do the math. You're right. That's a long time. What we do at Penn Dynamic is we take those two services and we blend them into one. We'll run alongside the Medicare team and the doctors so that when someone comes home from the hospital, they can get better quicker. Yes. So we take the home program from the physical therapist and the occupational therapist and the speech therapist, and we help the patient to do the therapy exercises because the patient is responsible for that. But what if they're tired? What if they're dehydrated? What if they're wicked? What if they have memory or cognitive problems, right? That's where we come in the home care space. One of the ways that we at Penn Dynamic make this process really well is we bring to the care a science methodology that helps us cut that 3 to 7 days, almost half, sometimes more than half. So our patients get better faster, but it's because of the fact that we have put together the understanding that every family, every patient, every care situation needs to be personalized. If you personalize the care and you make it so that you're concentrating on the areas of care that will bring the person the fastest recovery, the person gets better very quickly. So that's the difference between home care and home health care. So if you have someone that is coming home from the hospital, you have a loved one, someone that is struggling with being well, we invite you to call so we can help to provide some guidance. We will come to your home or wherever you're getting care. We will come to an assisted living, we'll come to a nursing home, we will come to independent living, to your private condo, to the in-law suite that your in-laws has. Wherever someone is, we call it the point of care. We will provide for you guidance. We will help you build a plan to help you get better, to help your loved one get better. But that's an important thing for families to know. There's a significant difference between home care and home health, and most people need both. All right. Jennifer, questions that may have come up this week? Anything or comments that may have come to your desk that we may need to share and or answer? Or are you going to talk about this on when we get to the next segment about reducing the cost of care? Because usually those questions they get woven into that question of, oh, I need care for my mom, I need care for my dad, I need care for my aunt, I need care for my neighbor, for my godmother, my godfather, and what do I do? Yes? Okay. All right. Anything else we need to add in today's segment?
If you have any questions, you can call us on 610-467-7827 extension 3.
That's right.
You go to our website, dynamiccareathome.com, and look us up. Also, we have a YouTube channel. You can LinkedIn. Also on Facebook, just type Penn Dynamic Care at Home. It will show up. Yeah.
Very, very good. That is very, very good. Jennifer, someone had reached out and the person said, oh, that's a good thing. I really enjoyed the conversation you guys had with the case, talking about case managers. And so I was trying to share the fact that we do this in collaboration with the Caregiver Relief Network and the National Care Planning Council, which are all platforms where families would go for support. So it's really important that people realize that regardless of your ability to pay, we can guide you. All right. We will see you in our next segment where we're going to be talking about how to reduce the cost of care. Take care of yourself, and we shall see you soon.